Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Tami Burdick. She's a patient advocate. Today's Kevin MD article is How Collaboration Saved My Life from a Rare Disease Doctors Couldn't Diagnose. Tami, welcome back to the show.
Thank you so much for having me. I appreciate it.
All right, so tell us what led you to write this article on Kevin MD.
Yeah, so I was influenced to write this article for you because of my own journey and experience when I was battling an emerging women's health issue known as granulomatous mastitis. And there's a multitude of frustrations that patients will normally experience with the disease. Obviously, we've talked about that in previous conversations, but it really led me to write the article because collaboration in our healthcare system needs to be what we should be doing moving forward. And I think if we allow collaboration to really be more of an existence and kind of a routine process or practice, I think we're going to be able to provide patients better long-term solutions in care and treatment.
All right, and I think what you said about collaboration is something that is really lacking.
Yeah.
Speaking from a physician standpoint, a lot of doctors practice in their own silos, and sometimes getting doctors to talk to one another, whether it's primary care to specialists or vice versa, can be a difficult task. So tell us more about your article for those who didn't get a chance to read it.
Yeah, so the article is based on trying to influence more collaboration in our healthcare system, but I broke it down into kind of three components or three types of collaboration. And you have the doctor to patient collaboration, where an experience with myself and my surgical breast oncologist, she was willing to listen to me, be open to my research, and to ordering the test I requested. And had she not been open, things would have been very different for me. And she wrote in my book, actually, that she just didn't have the time to devote to the research that I did to get us the answers. And, while I appreciate everything that she did for me, at the same time, it should never be the patient's responsibility to do the research and kind of spearhead a case. And then in addition to that, the collaboration should be seen in more of a different type of practice outside of Western medicine, where we kind of blend the two together. And in my story, my surgical breast oncologist and my functional medicine practitioner had actually teamed up together. And so we had the Western medicine plan of action, and then we also had, from a functional medicine perspective, when we might do certain things. Is there other things going on with this patient that could help explain, the diagnosis? And then you also have, thirdly, the other type of collaboration is patient to patient.
Mhm.
And with that, nobody knows your body better than you do. And no one's going to know the disease or the illness better than other people going through it. So there's really an opportunity for different patients to team up together. And that's kind of what my support group that I joined is all about. We share so much information, and oftentimes we'll find more information there than we ever would in the healthcare system. So I think if we kind of focus more on trying to advocate of having these different types of collaborations in our healthcare system, we can really kind of change the overall operations and improve so much results.
So take us into the exam room when you had this collaboration with your surgeon and you brought the research that you did independently. So what did those conversations look like?
My functional medicine practitioner had requested my surgical breast oncologist to order some tests from a Western medicine perspective, which graciously she was able to do for us. And collaboratively, we took all of the information from both practices, and then we were able to kind of create a plan of action as well as treatment, and when these therapies and when surgery, because I ended up having to have surgery, would take place.
Now, do you find this type of collaboration where a Western trained clinician would collaborate with a functional medicine clinician? How common is that from your experience and talking to other patients in your support group and forums?
I don't think it's very common at all. And I think partly the issue is that a lot of these healthcare systems really don't give doctors the time to allocate with their patients. And oftentimes, like I'll even experience what I feel is like my doctor's trying to rush me through the appointment. And I actually experienced that recently with something. And so I'm not trying to blame the doctors here. I'm kind of putting the weight and responsibility back on to the healthcare networks. Like we need to let doctors be doctors again. And that's where I think there's just so much opportunity for us to have this functional medicine and Western and all the other different practices, team up together. But they have to have the time to be able to do that. And their time is already so minimal as it is. And if you do the research, I think it's like 18 minutes on average
Mhm.
for a doctor with a patient. And honestly, you can't really accomplish much in that time.
So speaking from the perspective of a patient who had a difficult diagnosis that wasn't apparently obvious, what does it mean to you that your surgical oncologist was open to your functional medicine practitioner and was able to spend that time thinking outside that box and collaborating with that research not only with you but with your other clinicians as well?
So Dr. McLean is a very unique find. And truly, I was completely blessed to be able to be her patient. She had great bedside manner. She had the ability to really listen to her patient. She was so open-minded. And I think it really starts with having the right doctor and the right mindset to be able to allow these different types of collaboration to be implemented in a patient's case. And for me, it was just so critical that this partnership took place because my journey with granulomatous mastitis had so many questions that needed answers, and it just wasn't readily there. I did a significant amount of research. I mean, months and months of research. And it took 7 months before we even found what was the driving force of my disease process, which was the environmentally associated bacteria. So it means a lot to be able to think long term that we can bring collaboration as kind of like the new way of healthcare.
Now, whenever you see a new clinician, do you vet that clinician and ask them questions to see how open they are to the collaboration that you would like to see?
Yes. I get a very kind of good vibe about how the doctor is going to be, I think, even meeting them for the first time. I was so sad that my primary care physician retired earlier this year. He was very, open-minded. He's kind of like the diagnosis detective with me. He's a doctor that really wants to dive through data and analyze it and look at symptoms and kind of look at everything as a whole so that the patient's care is number one. And that's really what it should be about. So I definitely am vetting clinicians because if we're not going to vibe and they're not going to have my same mindset, then it's just not going to be good for either one of us.
So you said that you had a vibe as to whether a clinician would
Yeah.
be collaborative, but can you give some specifics? Like what specifically are you looking for? Just so other patients can also get a sense of what you're looking for whenever they're vetting their own physicians and clinicians see if they're open to collaboration. What exactly do you mean by a vibe? What exactly do you look for?
So, how much is the doctor willing to sit and listen? Are they willing to be able to provide the answers to all of my questions? And I mean all of my questions. I don't want, one or two questions and then I have five more that are just going to be, left out there and unanswered. A good vibe is going to be that bedside manner, getting to know me as a person and not just somebody that's coming in here with a symptom. What is their approach like? Are they going to be open minded to running tests? Because it's happened over and over and over again. And we've had a podcast interview on medical gaslighting. Over 70% of women have reported experiencing that. So for me, I don't want to be a victim of medical gaslighting. And in order for that not to happen, part of the vibe that I need from my doctor is their ability to be open to running the tests that are necessary so that we can get proper diagnoses and proper treatment. Because I don't want to be a case out there where someone's gone to their doctor like, oh, I've got these GI issues, and the doctor's just assuming without doing any test or doing minimalistic tests that they just have IBS or IBD. And guess what? They have colon cancer. So I don't want to be that case.
Do you have any advice for clinicians, like you said earlier, who are under a tremendous amount of time pressure to balance the time that they should spend collaborating with the patient and other clinicians versus the pressures that they face from the healthcare system? You did talk about earlier that the health system itself needs to change, and I certainly agree with
Yeah.
that. But how about for those individual clinicians in terms of balancing the time they should spend with difficult diagnoses versus all the other patients that they have to see waiting in the exam room?
Yeah.
How can they balance that?
And how you just said all the other patients in the exam rooms, that goes back to the healthcare networks. They probably have some sort of expectations of how many patients should be seen every hour, every day, every week. And I think that needs to be reevaluated. And a lot of that pressure from their networks, I think, often reflects back onto the doctors, and then it reflects onto the patients. And that's something that I hope that we see change. But if you're not a clinician or a practitioner in your own private practice, then you kind of have, this corporation like way of doing things within the healthcare system. There's limitations, there are expectations. And, at the end of the day, the healthcare system is a business. Every business out there is in it to make money, but it shouldn't come at the cost of the patient care and what they need.
What kind of advice do you have for other patients who may be going to a corporatized health system where their physician only has 10 to 15 minutes with them? How can they better advocate for themselves to get the collaboration that you receive from your medical team?
Yeah, take someone with you. I think that's always going to be a good thing, whether there's someone advocating for you or there's just somebody there to help you take notes, because then that will give you the opportunity to focus on more of what you want to accomplish if you have someone there taking the notes for you. Advocating for yourself is huge in the healthcare system. And I know it's not always easy for people to do that, especially like with my parents. And you can even use artificial intelligence now, to kind of help better prepare you for the appointments. Maybe you put in some tests that you've had, like the results, what they were, and put in your symptoms and kind of see what AI comes up with. Maybe you go to your doctor and be like, okay, this is what I've got here. Let's kind of explore this if you're open to it and see if we find anything or if what we find kind of matches up to that. So it's really all boils down to being able to advocate for yourself and come up with like your top 5 things that you want to accomplish in the appointment. Maybe you let your clinician know ahead of time. I got 5 questions and I want to make sure we get through these in the appointment today.
So that leads me to my next question. You mentioned about artificial intelligence, and we have these
Yeah.
tremendously powerful tools that's really evolved so rapidly over the last few years. Now, from your interactions with other patients and in patient support groups, in general, how are patients using something like a Chat GPT or a Google Gemini in terms of their own medical journey? How are patients using them today?
I mean, I've seen on social media where patients have taken their symptoms and maybe some data from tests that they did have and kind of get an idea from artificial intelligence on what a potential diagnosis would be. And I actually did this recently for my father. He's got all of these abnormal test results and he's got several symptoms. I went to AI. I put in his symptoms, I put in his test results, and it came back highly suspicious for a gluten allergy. And I'm like, really? That would make a lot of sense. And his doctor is just very laxed about it. He's not really, looking into any of this. And he's just kind of like going with the flow, like, oh, well, about it. Like, he hasn't even called my dad about recent test results. So that's the kind of thing that I want to hope for other patients are not going to have to experience.
We are talking to Tami Burdick. She's a patient advocate. Today's Kevin MD article is How Collaboration Saved My Life from a Rare Disease Doctors Couldn't Diagnose. Tami, as always, let's end with some take home messages that you would like to leave with the Kevin MD audience.
So, my take home message would be to always be your best advocate, because advocating for my health is what helped me get cured of granulomatous mastitis. I would also say moving forward, obviously never be scared to ask your doctor questions, request results, and hopefully as we all move forward and we work together as a team, which often is used in business, together everyone achieves more, we can really change collaboratively how our healthcare system gets the results, and they can be better for everyone involved.
Tami, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.